Now turning to 12 Responds, a local woman is sounding the alarm saying she received one of those fake text messages from the DMV asking her to pay a toll or face the consequences.
I got one of those too. 12 News consumer reporter Sarah Granelli is here now with the warning. Sarah?
Well, Kim, Linda Martell is one of several people who reached out to us saying they too got a scam text message from the DMV. So she spoke to us because she doesn't want anyone to fall for the scam.
This is a text message Linda Martell says she got on her phone earlier this week.
This letter serves as a final reminder of an outstanding toll violation linked to your account.
The text continues saying she needs to pay up or a registration and license would be suspended. Martell says at first she thought it was real.
I got kind of a little nervous because I don't want nothing to happen to our stuff, you know. And when I read about tolls, then I knew that wasn't right. So that's when I kind of figured out.
Martell is not alone. Over the last few days, several people have reached out to 12 Responds, concerned about these fraudulent text messages. Then the Rhode Island Division of Motor Vehicles issued a warning, saying bad actors are trying to get you to submit your personal or financial information, and that these text messages are not from the RIDMV. Paula Fleming from the Better Business Bureau says these types of scams are often called imposter scams.
Victims are often driven by emotion and they act immediately. And unfortunately, because they're fearful of facing penalties, we're encouraging people to please take a step back. Don't respond to an unsolicited text.
Martell says she turned to 12 Responds because she wants to make sure no one falls for a scam like this.
Pay attention really well. When they ask for money, do not do anything. If there's a link on the bottom to click on that says to go on here and pay your fine or whatever, do not do it. Check with somebody first.
And other versions of these scams from bad actors are pretending to be from your bank, a fake delivery problem, a phony job opportunity. But before responding to any of these text messages, directly check with the company to make sure they actually sent it. In the studio, Sarah Granelli, 12 News.
I said to my wife right away, I was like, I think I just got scammed.
That local man turned to 12 Responds after falling victim to a text message scam.
He was out thousands of dollars, so he turned to Target 12 consumer investigator Sarah Granelli for help. Sarah is here now with the story.
Well, Mike, Kim, Derek Barden says he got a text message from someone who was pretending to be from his bank. And within a short amount of time, he was out more than $2,200.
This is a text message Derek Barden says he got on his cell phone in October.
I got a text message on my phone. It said from TD Bank Security, did you attempt a $1,000 Zelle transfer?
He replied no. Then he says his phone rang. Once he picked up the phone, he says he thought it was someone from his bank, alerting him to fraudulent activity on his account.
They sounded very professional, just like I was talking to someone from TD Bank. We need you to authorize this so that we can try to reverse the transaction. And I felt silly with it afterwards, but in the moment it sounded like it was the real deal.
Barden says he started to panic, so he gave over his account information. It turns out the person on the phone wasn't someone from his bank. He says it was a scammer.
I gave him the card number and the expiration date, and they're like, all right, well, we're going to send you another text that you have to authorize it so that we can reverse the charges. I knew it sounded odd.
Then he got this text message, this time from his actual bank, alerting him to a more than $2,000 charge. He knew he fell for a phishing scam, so he locked his card right away.
I went to TD Bank and ran it by them. They did an investigation and they ended up sending me a letter that said that because everything checked out with the account number and this and that, it wasn't fraudulent activity.
So he turned to 12 Responds for help. 3 days after we reached out to TD Bank, Barden says he got his money back. A spokesperson for the bank said they reached a positive resolution. Here's what he says he wants people to know.
Keep your wits about you, if you will, because like I said, I got nervous. So I was going to believe just about anything, and I kind of fell for it. There were enough little signs that I should have noticed that this wasn't right.
Barden says he knew something wasn't right when the person on the other end of the phone used pressuring tactics for him to give over his information. If you think a scammer has reached out to you, hang up the phone right away and call your bank directly. In the studio, Sarah Gordelli, 12 News.
Turning now to 12 Responds. A local woman says her brand new car was stuck in the shop for months because of a recall.
She says she eventually had to take the dealership and a national car maker to court, and she reached out to 12 Responds for help. 12 News consumer investigator Sarah Gordelli is here now with the latest. Sarah?
Bethany Van Etch says she couldn't drive her 2023 Jeep Grand Cherokee for about 4 months, yet still had to make her monthly lease payments. So she took the car maker, Stellantis, and the dealership, Elmwood Auto Group, to court. Stellantis would not comment, citing the litigation, while Elmwood Auto Group says they advocated for their customer.
In November 2023, Bethany Van Etch says she leased a Jeep Grand Cherokee from Elmwood Auto Group in East Providence. But then 2 years later, the car started having some issues.
The car just all of a sudden started to shake and buck, and then these error codes were flashing and noises were going off.
She says she brought the car back to the dealership in May of this year. Then she says she was told by the dealership there was a code defect and the car sat undrivable for 4 months. So in October she filed this lawsuit citing a recall that was issued for her car, impacting more than 91,000 vehicles.
I thought it would be an easy fix and that I'd be on my way. They could have been more reasonable in how they handled it, and maybe we could have come to a happy solution by now.
The lawsuit alleges she attempted to negotiate a new lease with Elmwood Auto, and she proposed swapping the recalled car with a different one. The lawsuit states that even though the replacement car had a price tag of $16,000 less, the lease would have gone up $140 a month.
My proposed solution was, can you just give me an equivalent drivable car and I'll write out the terms of this lease. They didn't go along with that idea.
Elmwood Auto Group tells 12 Responds her original vehicle was a plug-in hybrid. They say the replacement vehicle was a gasoline model. The dealership says the higher payment was because of changes to the manufacturer's incentives, interest rates, and the absence of federal credits, not dealership pricing or markup.
I understand that there are many other Jeeps right in Rhode Island with the same error code. So I'm hoping that by speaking with you, we can draw attention to it and maybe help other people who are in the same situation.
After we reached out to both Stellantis and Elmwood Auto Group, her attorney, former Providence Mayor Angel Tavera, says that they've entered into a settlement agreement, but couldn't say much more. In the studio, Sarah Gordelli, 12 News.
After we reported on failed Medicare Advantage plan negotiations between United Healthcare and Brown University Health, both companies agreed all procedures scheduled before July 1st should be covered. I'm Mike Montecalvo.
And I'm Shannon Heggie. But one woman says that wasn't the case when she went in for a surgery and walked out of the hospital without it. Target 12 consumer investigator Sarah Gordelli is here now with the latest 12 Responds. Sarah?
Well, Shannon, Mike, after finishing months of cancer treatment, Susan Epstein says she went in for that surgery that was scheduled in June, only to be told she'd have to be paid out of pocket.
I was angry.
Susan Epstein is the latest Rhode Islander caught in the middle of failed Medicare Advantage plan negotiations between United Healthcare and Brown University Health.
It's July 8th. I fasted for 12 hours. I'm in there on the table. They put the IV in. They've swabbed my nose with antibacterial stuff.
After she was prepped for surgery, she says she was told her insurance wouldn't cover the procedure. She says it was scheduled in June. This comes after both United and Brown Health told Target 12 that any service that was scheduled before July 1st would be covered.
What did you make of that when you were in the room waiting to go into your operation and they told you you weren't covered by insurance?
Well, first of all, I almost didn't know what to do. I said, oh my God, I'm here. Am I really not going to do this? And then I thought to myself, why wasn't I notified? Why wasn't I notified by either or both my health insurance or the coordinator in my physician's office?
A United spokesperson said privacy laws prevented her from commenting specifically on Epstein's situation. But she said in a statement, services that were approved and authorized by United Healthcare and scheduled to occur after Brown University Health hospitals went out of network July 1 will be covered for our United Healthcare Medicare Advantage members. Epstein says she still hasn't gotten a clear answer from either healthcare group, adding that this only adds to her stress because says she's been receiving cancer treatment at Brown Health. Now she wants to share what's happened to her in case others are dealing with a similar situation.
I know that there are probably people in worse situations than me. I'm hoping that someone says that maybe they see this or they read it and they say, wow, that's exactly how I feel. I'm just as desperate as she is to get this done and get back to normal, if there is a normal.
Epstein says she has since rescheduled her surgery with a different hospital outside of Brown University Health, as well as her follow-up appointments for her cancer. Brown Health also couldn't comment because of privacy concerns. With the Target 12 investigator, Sarah Granelli, 12 News.
Doug Mararian, who didn't want to show his face on camera, spent his career as a firefighter. It was his passion, helping others in need.
It's something that kind of like a calling. You're trying to search a room for people, pets, anything, that you come across. Hopefully you can get them out.
In 2001, while at work, he was on top of a fire truck when the hose came off the line, knocking him to the ground. That fall caused him to break his leg, and he ended up getting surgery. He says years later, his leg would swell, and he was getting sick without knowing why. Then doctors discovered an infection that destroyed the bone in his legs.
So I accepted that, took the leg. I think not even a month after they had taken this leg, the blood flow stopped in this leg.
Mararian says he needed adjustable prosthetic legs because the swelling in his legs varied day to day. When the prosthetic facility submitted the claim to Harvard Pilgrim Healthcare, they approved 10 of the components. But they denied the adjustable mechanism because it was considered a non-covered investigational service, meaning there hasn't been enough research done to know if it's safe or effective, despite being on the market in 2023. After months of waiting, he got a call from his prosthetic facility.
Your insurance company hasn't paid for these. He said they're refusing to. But he says, you need these. He says, so I'm going to give them to you to use until we can get this worked out with the insurance company.
Mararian said he reached out to 12 Response, hoping that the insurance company would reimburse the prosthetic facility, who is out thousands of dollars.
It's not fair to the prosthesis maker, especially. To heck with me. The prosthesis maker is the one that's going above and beyond and allowing me to use these things.
After we reached out to the insurance company, the prosthetics office said that they got approval for the adjustable sockets. Harvard Pilgrim says it was a mistake and the issue has been fixed. In the studio, Sarah Granelli, 12 News.
Turning now to the healthcare crisis. We've been tracking the failed negotiations between United Healthcare and Brown University Health for more than a month. That collapse has left thousands of Rhode Islanders with Medicare Advantage plans without insurance coverage at 4 hospitals in the state.
Target 12 investigator Sarah Granelli has more on how our reporting has made changes for some patients and what the Attorney General has to say about it. Sarah?
Well, Kim Shannon, the Attorney General, says these failed negotiations are only hurting Rhode Islanders.
Attorney General Peter Neroda has been sounding the alarm about Rhode Island's unraveling healthcare system, including the failed negotiations between United Healthcare and Brown University Health for people with Medicare Advantage plans.
It certainly doesn't help, and we're seeing a lot of healthcare disputes across the state.
The companies had until June 30th to come to a new agreement. Now thousands of Rhode Islanders no longer have insurance coverage at 4 major hospitals in the state.
I think the good news for Rhode Islanders is that, as I understand it, they can still see their doctors, and so they haven't lost their primary source of getting care.
This comes as Target 12 has been reporting on the contract issue for more than a month, leaving many people like Stephen Palumbo and his wife Patricia distraught after he had his back surgery canceled because of the fallout.
When we got the telephone call that the surgery was canceled and he could no longer have it, we were both devastated.
Since this story aired, both United Healthcare and Brown University Health officials now say patients who had a hospital procedure or service scheduled before July 1st will be covered by insurance, including Stephen's surgery that will help him walk.
We really appreciate you and couldn't have done it without you. Stephen's going to be able to walk.
I'm just so looking forward to being able to stand up for a longer period of time without like insane pain.
While the Palombos wait for the surgery, they have a message for others dealing with healthcare issues.
You got to keep fighting. You got to speak up. You can't just lay down and accept whatever's going to be dished out.
Stephen's surgery was rescheduled for September. Brown University health officials say they're working to reschedule appointments. It's important to note if you have a Medicare Advantage plan, you'll still be covered.
Now turning to 12 Responds. We've all heard of man's best friend, and that rings true for a local veteran and his service dog, Bob, who recently had surgery.
But the cost of pet care is pricey, leaving the veteran turning to his community for some help, while also sharing why he believes more veterans need access to service dogs. 12 News consumer reporter Sarah Granelli is here with their story. Sarah.
A study published in 2024 shows veterans and military members who suffer from post-traumatic stress disorder benefit from having a service dog. And that's the case for Navy veteran Paul Shafsma and his dog Bob.
Come on, up.
Meet Navy veteran Paul Shafsma and Bob. Bob not only likes to give kisses to our camera, but he's Shafsma's service animal.
Like with ADA compliant dogs, he's basically my left ear. And like if I'm out in public and my right hand starts shaking, he knows to nose up to my hand and let me know, because I don't even know what's happening.
He says he suffers from PTSD, and Bob has been right by his side for the past 10 years, not only helping him when he needs it, but the pair have also traveled a lot together.
We've been up 14,000-foot peaks. He's met bison, he's met elk, he's swam in Atlantic in the Pacific.
Bob recently had surgery to remove tumors, which Shafsma says he's paying for out of pocket. He says it's because Bob is not covered by the VA's dog veterinary health insurance.
It just really stinks when you find out at the end that the VA actually has this insurance policy, and just due to convoluted policies and unending paperwork, it's near impossible to get if you self-train your dog.
The policy requires veterans to be prescribed a service dog. Then the dog has to go through a specific training program, which should be free. Shafsma believes this process has turned many veterans away from trying to get a service dog.
We're trying to get the VA a little more proactive in what these dogs can actually do for our lives.
According to this 2024 study by the National Institute of Health, an estimated 23% of military members and veterans with post-9/11 service have PTSD, and veterans are more likely to die by suicide than non-veterans. The study used 156 military members and veterans with PTSD and found partnership with a trained psychiatric service dog was associated with lower PTSD symptoms, a disorder that's difficult to treat. Shafsma says he and his fellow veterans want the federal government to find a way to increase access for veterans to get service dogs.
I'm saying I've talking with other vets where we're thinking about approaching a major U.S. insurance company that covers veterans to see if maybe they will offer a little pet insurance policy just for us.
The dog benefits that are provided through the VA started in a pilot program in 2016 where 652 veterans with guides or service dogs received those benefits. If you'd like to donate to Bob, we have a link to his GoFundMe page on our website, WPRI.com. In the studio, Sarah Granelli, 12 News.
Now in our latest 12 Responds, address confusion almost caused one couple in Foster to lose their health insurance.
You see, they live in Foster, but their mail is delivered just over the border in Connecticut. Frustrated, they contacted Target 12 consumer investigator Sarah Granelli. She's here now with more. Sarah?
Ed Fulaz has cancer and his wife has serious health issues. Both say they were scared when they got a letter in the mail from their health insurance company saying they'd be dropped by August because of a mailing issue.
On this sprawling land in Foster, next to a babbling brook, is where Ed Fulaz and his wife Jane call home. Their property is right on the Connecticut border, and that state line location almost cost the couple their much-needed health insurance.
She was in a hospital for 51 days, and right now I'm going through radiation for cancer.
They received this letter in the mail in February, stating that their insurance company, United Healthcare, received information that their address either changed and they may not live in the area that's covered. Ed says their physical address is in Rhode Island, while their mailbox has a Connecticut address. He says he was scared that the couple would lose their insurance coverage.
You imagine what that would cost if I wasn't covered by insurance? It'd be thousands and thousands of dollars.
Ed says he tried relentlessly to get a hold of the company to explain their situation, but had no luck.
I've spent hours on the phone. It's just terrible.
With having exhausted all options, Ed turned to 12 Responds. We sent an email to United Healthcare and included these documents to prove where they lived. Ed, who spent hours on the phone, said he got a call from the company right away, then shifted his focus to tackle the split address problem altogether.
I just want a Rhode Island mailman to come here. And I even have a circular drive so he can turn around. It's no big thing.
Fulaz says their health insurance issue is all worked out. He also got a foster mailing address, so something like this won't happen again. Sarah Granelli, 12 News.
Now turning to 12 Responds.
A Rhode Island duplicate license plate caused a major headache for an 88-year-old woman in Smithfield.
It's all baloney. That's what it is.
Yeah, she was accused of driving a tractor trailer and getting into an accident in New Jersey.
But she says that never happened. Target 12 consumer investigator Sarah Granelli is here now to explain. Sarah?
Gloria Gabriel and her son were shocked and confused when Gloria got a letter in the mail from a rental car company saying she had been driving a tractor trailer with a car haul trailer and hit a parked car in New Jersey.
The ones that show the car.
Gloria Gabriel holds up photos of the SUV she supposedly hit in New Jersey while driving a tractor trailer in September of last year.
Now let me ask you this. Have you ever driven a tractor trailer in New Jersey?
No. I only go from here to the center, which is right down the street. It takes me 8 minutes to get there.
The problem boils down to this. The driver of the truck has the same license plate number as Gloria, but with a commercial registration, while Gloria has a passenger plate. This letter came in the mail saying she needed to pay for the damage done, totaling $2,682.
It was 12 pages. They went through every detail. You know what? You feel like a criminal.
12 News has been documenting duplicate license plate issues for years. 6 years ago, this man got a ticket in the mail for a duplicate plate issue. A similar issue for this man in 2021 and another man in 2022.
My son said, Ma, I'm gonna call 12, he said. They helped us before.
Her son, Tom Gabriel, lives in Arizona. He says he jumped through hoops contacting the police department in New Jersey to amend their initial report and the rental car company to clear his mother's name. But overall, his frustration lies with the Rhode Island Department of Motor Vehicles, who issued duplicate plates more than a decade ago.
Even though they stopped issuing them, they're still out there. So the problem isn't solved. And I really think the legislature or the DMV, I don't know who has to do what, but they need to fix this.
According to DMV officials, the only way to correct the problem would be to cancel all existing duplicate plates and give out new registration to those vehicle owners, but explained it would be difficult, expensive, and would likely upset vehicle owners. For Gloria and her son, they want people to know that this problem still exists.
I feel bad if it has to happen to someone else, really. And, you know, you need the stamina to just say, come on now, enough's enough. And that's my story.
The spokesperson also says duplicate plate numbers may appear on different plate types, like in Gloria's situation where a passenger plate has the same number as a commercial plate, but no two passenger plate numbers are the same. In the studio, Sarah Granelli, 12 News.